everybody, and welcome to the August edition of our Rural Health Summit webinar series as we tackle a number of issues in our efforts to build a healthier rural Illinois. Today, we're going to be talking about and discussing with an incredible group of panelists how COVID-19 has affected rural nutrition and fitness. My name is Samir Vora, and I am a primary care pediatrician and the chair of SIU School of Medicine's Department of Population Science and Policy, and would like to welcome everybody on behalf of our department and our chief collaborators in this initiative, the University of Illinois Chicago School of Public Health, SIU Medicine Center for Rural Health and Social Service Development, and the SIU Paul Simon Public Policy Institute. For those that have been with us, you know that this is the fourth in a series of 9 webinars that's been brought to you by the Illinois Rural Health Summit Planning Committee, consisting of these partner organizations. We have had a series of great conversations so far around caring for our aging population, mental health, public health systems, and we'll be focusing on a series of additional topics through January 2022. And for those interested in attending any of our future webinars, you can find access through them through this QR code shown here. So today we're going to be talking about rural nutrition and fitness. And in order to do that, to better understand how our rural communities think about their healthy diets, how they remain fit, we wanted to bring a group of really powerful, dynamic professionals who are in these communities thinking about this work, and also some policy leaders that are thinking about overall rural development in thinking about how we build and transform our rural communities. And so I want to take the opportunity to introduce them and their bios right now. And so first we'll start with Molly Hammond. Molly Hammond is the Acting State Director of the U.S. Department of Agriculture, Rural Development in Illinois. Before being appointed to this role, Molly served as the Illinois Associate Director for USDA Rural Development in the state. In a previous role at Rural Development, she worked with businesses and lending institutions throughout the state on financing new and expanding business ventures, coordinating the agency's renewable energy and energy efficiency efforts in Illinois, and coordinated available programs with Illinois electric and telephone cooperatives. She is the past chair of the board for Illinois Rural Partners and a graduate of the University of Illinois with a Bachelor's of Science in Finance. Thanks so much for joining us, Ms. Hammond.
Thank you, Dr. Ward.
Thanks. Next is Ms. Donna Hawkins. Ms. Hawkins is the Maternal Child Health Supervisor with Coordinated Youth and Human Services. Since 2017, Donna has been responsible for the overall administration of programs such as WIC, HRIF, HealthWorks, Breastfeeding Peer Counseling, Farmers Market, and Healthy Families Illinois. In addition, Ms. Hawkins coordinated the Southern Illinois Healthy Children's Task Force. She has received several awards in her career, including the USDA WIC Loving Support Award of Excellence in 2018. Ms. Hawkins has a Bachelor's of Science degree in Business Management from Eastern Illinois University. Thanks so much for joining us today. Next is Mr. Sean Park, who is currently the Program Manager for the Value Added Sustainable Development Center at Western Illinois University. He works with rural entrepreneurs, cooperatives, and communities to develop business plans, find financing, and operate needed services successfully. He has years of experience teaching business development and currently teaches in the Community and Economic Master's Program at Western Illinois. Following his undergraduate degrees in economics from SIU Carbondale, he opened Park Foods, Inc., operating as a small grocery store in Rushville, Illinois. He is a certified exit planning advisor, a certified business advisor, and a doctoral student in public administration at University of Illinois Springfield. Thanks so much for joining us, Mr. Park.
Thank you.
And then our last panelist is Miss Angela Sotzenberg. She holds a Master's of Business Administration and a Bachelor's in Health Administration. Ms. Sotzenberg has over 20 years of experience in nonprofit management and community partnerships, and she has spent the last 9 years as the Director of Community Health at Abraham Lincoln Memorial Hospital, a critical access hospital located in Lincoln, Illinois. In her current role, Ms. Sotzenberg oversees community outreach and efforts towards a vision of becoming and making Logan County the healthiest community in the nation. Thanks so much, Ms. Stolzenberg.
Thank you for having me.
So before we get into the panelists, just sort of a reminder on the process that got us here. And so the Rural Health Summit Planning Committee in late 2020 and early 2021 convened stakeholders for 11 discussion forums to better understand and address the COVID-19 pandemic in rural Illinois. 80 leaders from 55 organizations across public health, healthcare, academia, industry, government met virtually to discuss how the pandemic is creating new challenges, but also fostering incredible innovation in our rural and small city communities across the state. Those discussion forum participants were also invited to additional sessions to identify common challenges and create the beginnings of impactful solutions. The information, anecdotes, and issue raised in this brief and the briefs that follow from those conversations will be the basis of our discussion today. And so for those that have not seen those previous briefs, it started off with a big picture report titled Building a Healthier Rural Illinois, Understanding and Addressing the Challenges of COVID-19. That was released in March. And every month for the following, we've had a follow-up report on a specific issue and then followed those up with the conversations in these webinars. In April, we tackled COVID-19 in an aging rural population. In May, we talked about COVID-19 in rural mental health. In July, we discussed COVID-19 in rural public health systems and released this fourth brief last Thursday around COVID-19 in rural nutrition and fitness. And all of those reports can be found on our Rural Health Summit website, which we will share in the chat and can also be found with that QR code previously established. So we'll take down the slides and we'll get straight into our conversation. And Ms. Hammond, we'll start with you to sort of maybe give us a little bit of a big picture from your vantage point at the USDA and thinking about rural development. And as we think about Illinois' rural communities, where did we sit sort of before the pandemic? And how has the pandemic, right, and I imagine in so many ways, but give us a little bit of a insider's view on how it's changed the approach of how USDA rural development is looking at its work, and specifically the things that you're thinking about every day in your very busy position.
Thank you. And just as a little backgrounder for those who aren't totally familiar with the branch of USDA, which is rural development. So, 17 agencies and offices within USDA, and we are the one who is solely focused on economic development, rural development in rural Illinois and across the nation. So we do loans and grants for businesses, communities, housing. We have both single family housing and multifamily housing. So our portfolio is $4 billion. We have thousands of borrowers. So immediately, as the pandemic began, we saw the hardship on our borrowers. So the flexibility that came in, which traditionally, with government loan programs, they're pretty straightforward, but there had to be a lot of flexibility and new ways of looking of how to handle issues because our borrowers no longer could make their payments each month. So we did, of course, across the government, there was an eviction and foreclosure moratorium that still is in place today. We did loan deferrals, without any question. Basically just trying to make sure that the borrowers could put themselves and their families first for a while. The loan payments can be worked out later. So that was kind of where we started. And then as we've, continued on through the pandemic, now it's more on rebuilding. And so how can we use our programs that currently exist to help communities, residents, multifamily housing managers, businesses, how can they move forward and how can we be a partner with them for their financing needs?
Yeah, thanks so much for that overview. And part of the reason we want to start in thinking about this, and as you have seen from our biographies from our panelists, is that as we think about rural nutrition and fitness, so much of this also aligns with the business models and the abilities of our rural communities to create the type of infrastructure that's needed for healthy food and the activity that comes along with it. And so with that transition, I'd love to go to you, Mr. Park, to tell us a little bit about the work that you're doing, right? We know, and we don't often think about it that way, at least in the national conversation, that, rural spaces, a lot of agricultural-based economy, and there should be tons of access to healthy foods and the types of lifestyles that create, fit and healthy individuals. But, the data is really powerful that, 40% of rural adults are obese in rural areas compared to 33% of adults in metropolitan areas. We know that there are 5 million people across the country in rural areas that have to travel at least 10 miles to buy groceries. And so tell us about how your work, right, even before the pandemic, was being built around creating more avenues for people to have healthier options for their food choices.
Yeah, so a little bit about our program. My background in retail grocery kind of came in handy as we started seeing a lot of rural communities losing their grocery store for economic reasons. And what we try to do in those situations, that's what creates that food desert where folks have to drive the 10 miles. And what we try to do is go back in and use an alternative business model. A lot of times it's a cooperative, but it's usually a community-owned business, and help them build their own retail facility where they can at least provide fresh fruits, fresh vegetables, fresh meat. And so, that really became kind of critical, that access through COVID, especially as it became less safe from a health standpoint to drive into the city, to go into larger retail outlets. And a lot of those outlets, through supply chain problems, didn't have the food even if you made the trip. So our purchasing local when possible and our having that access right there in the community became kind of important, very critical for some of these communities.
Yeah, thanks so much for setting the stage on that. Ms. Sotzenberg, I think one of the other things that has really come through in the pandemic has been the conversation around health disparities. That many individuals in the space, we would talk about things like social or structural determinants of health, that the things that were happening outside of the hospital or clinic, would have a substantial, up to 80% of the impact around an individual's health. And then we saw in real strong terms, both in urban, vulnerable communities, often communities of color, and in our rural communities, that not necessarily having that foundation led to worse outcomes. And much of that, also the link to healthier options with food and their ability to live healthier lifestyles. And that has put some pressure, but also a greater commitment on healthcare systems to think beyond the walls of the hospital. And I know this is something that Abraham Lincoln Memorial Hospital has been thinking about for years. Can you describe a little bit of the work that the hospital has been engaged in around community benefit, the work that started before the pandemic, and how it has changed and continues to change as the pandemic continues?
Sure. So the Abraham Lincoln Memorial Hospital has been thinking about this for a very long time, which I'm proud to say. And we have a pretty significant footprint in our community. We've thought for quite a while about access to fresh produce, access to physical activity opportunities. So a few things that we have done in recent years. We started a farmer's market locally, and with an eye on increasing consumption of fruits and vegetables, taking into account the economic impact that could have by having it be a producer-only market, locally grown food. And when it comes to equity with the farmers market, we've had our eye very much so on making sure that's accessible by providing free rides to the farmers market, and also having a SNAP match program. So we take link cards and match that, and we've really seen that grow, especially during the COVID-19 pandemic. And if we want to talk a little bit about the food system and the supply chain, and how there was a time where we really recognized how important it was for us to have our own sustainable source of food locally, that farmers market was really an important thing happening last year. We were proud to be able to still have that offering to our community with the farmers market. And that launched into connections with the agriculture community and our previous partnerships that we've had with our schools. We support our schools locally with the CATCH program, which is the coordinated approach to child health. And that is all about creating that healthy school environment, incorporating physical activity, but also about improving eating and valuing healthy eating. So we completed a project with our biggest local school district, impacting 5 cafeterias, changing them from frozen processed foods to from scratch foods and locally sourced foods. So we've been out there trying to improve access to all of those things for everyone and removing barriers.
Incredible work. And Ms. Hawkins, in the number of hats that you wear, and trying to get individuals to be able to access some of the services that we have. And would love for you to kind of, talk about that a little bit more. I think, when in the brief that we had mentioned, and when we saw what WIC enrollment was in Illinois in 2018, it was only 47.5% of eligible individuals. And that's lower than the national average of 56.9. But I think we also know that we do have some programs that are just not being utilized. And so we'd love for you to, share with our attendees where you see some of those challenges are in getting people to know the programs that exist. And then, how, to Ms. Sotzenberg's point, right, that especially during COVID, the challenges that we faced with our economy, that the lines that many of us saw and the needs from our food banks to get individuals. So how do we get people to utilize the services that are there, and how has the pandemic changed that? Unfortunately, Ms. Hawkins, you're on mute. No, let's try one more time to.
Now you can hear me?
Yep.
Okay.
Wonderful.
I'm not sure what happened there. I apologize. No, it was a challenge before the pandemic. I think statewide, all of us were really struggling trying to figure out why participation in WIC in our program had dropped. And so we tried to come up with a lot of strategies to increase participation, but I think what we've identified is many of our participants now are working or going to school and have limited time to do this. So, we've reached out to all of our community partners, doing a lot of outreach and education. During the pandemic, especially, we reached out to them, put information on our webpage that we were currently open. And I can tell you many clients are very excited that our doors were still open while a lot of other places were closed. We have a farmers market program that we, in addition to the WIC program that we run, and we also have a local farmer that comes on site. So he's been doing that about 6 years. So we are hopeful, it was more of a one-stop shop. They could get benefits from WIC, case management, and then just walk right outside the door and get fresh produce. So I believe that's going to help to increase the numbers. And, we do surveys every year, and the biggest way that people find out about our program is through other people. So our push is to provide the best customer service that we can and be as efficient as possible, recognizing that people have limited time. Getting back to COVID, it was a struggle to provide services in a different way, but I think it's been a very positive thing because now we have learned a lot. That we can provide services without the client actually having to be here in the clinic. We went from a no-show rate of 40 to 45% to now it's 20 to 25%. Clients are able to do their visits while they're, waiting in the grocery store or they're at work on a break. And I believe our numbers definitely are rising because of that. So hopefully that helps.
That's wonderful. And so would love now to kind of just take some of the insights that all of you shared and maybe dig a little bit deeper. And so going back to you, Mr. Park, why is it so hard for a rural community to be able to secure and keep a grocery store serving fresh produce, fresh meat, and get that to sort of continue to be able to deliver those options to rural residents?
Yeah, it comes down to that grocery store industry is just so competitive. We've got so many large players now. In the industry, the average is about 1% net profit. So you can imagine you're investing a lot of money into a store to build a new one, $2 to $4 million, and your return is 1%. So obviously, if you're an investor, there's other places you could go, and it makes it tough for economic developers to bring somebody in. And so as we're seeing that silver tsunami as baby boomers are retiring, no one's coming in behind them to pick up those stores. And that's really where we try to utilize a community-owned approach, because then our focus is about creating a business that is financially stable, but that its main motivation is providing a service and not necessarily profit for investors. So we pay the debts, we pay the loans, but it's not about the profit so much as it is providing that service, which is a little bit like rural electric began as well, providing a service that the economy couldn't do. And, as you mentioned before, it's a little ironic that we are in one of the best farmlands in the world, really, and we have food deserts that are in these little towns where people spend their whole career growing food. So.
Simon, we both need to kind of jump on that, right? And I think partly with your background and hearing Mr. Park sort of describe that, right? That thinking about rural electric cooperatives and co-ops. Has there been discussion on a national level, on a state level, to think about the placement of healthy foods in a similar way? Is that an idea that is getting some traction?
It is, and for several years, they've really looked at that local food piece as far as our programs go, even in urban areas. So, we are rural to the core. That's what we do, but we can even assist an urban food desert or a local foods project in Chicago if there was an area that was deemed it necessary. So it is so important. So some of our financing programs, we have it ranges from the value-added producer grant, where we're actually assisting the ag producer in maybe taking that raw commodity and adding value to it and putting it on the shelf somewhere. So whether it's tomatoes to salsa or grapes to wine or whatever it may be, we have a program that can assist the ag producer. But then one of our larger programs is the Business and Industry Guaranteed Loan. And we're actually able to assist a food processing facility or anything really through the supply chain because of the local food component. So a co-op grocery store, for example, could be an eligible applicant for that program. But it is, it's vastly important to the sustainability of a rural community is to have that place. I'm fortunate outside of Champaign where I have access to, dozens of grocery stores. But when you get into those really rural areas throughout Illinois and the next largest town is 45 minutes to an hour away, they really need something closer.
And I wanted to take a question from one of our attendees because I think it fits really nice in the conversation that we're having now. With so many small businesses having challenges, having to work and receive aid from the federal government, based in happy for anyone and multiple people to answer this question of, did there seem to be, from your experiences, a high number of pharmacies and or grocers closing during COVID-19? Or was it just that they weren't, established to that degree to begin with?
Yeah, we noticed that, especially from the grocery store standpoint, but I think probably from a pharmacy standpoint as well, that if it was an established business and kind of had worked out its beginning kinks and was on track, that COVID actually really helped some of these rural community small businesses because there was less travel. So a lot of our grocery stores were reporting much better sales during this period. And they're very cautious because they're afraid, as soon as people are able to travel again, they'll be driving into the larger towns and going to Walmart. And but over that period, it really has been helpful. And one of our stores, our pilot store, that's down in Scott County actually had to expand a little bit because of the extra volume. So.
And we'd love to take just one more follow-up on that. How have the influx of dollar stores, affected the landscape? And I know Western Illinois University has done some work on this too. I think part of that is often seen as a challenge of engaging a whole other organization or co-op company, grocery store, when the dollar stores are there competing and already having a good corner of the market.
Yeah, a lot of those stores are run by baby boomers. So, they're getting closer to that retirement age. It's already a very competitive market. They're probably not making a lot on the investment, so they're basically paying themselves as managers, and it's definitely a full-time job. It's probably more like 60 hours a week. And then when the dollar store opens up, it takes just enough of those sales out of there that it really becomes difficult for them to make that profit. They can't compete with, especially the dry goods that can be purchased in large volumes. And, you get that, well, the dollar store has it for this price. Why don't you have it for that? And that extra competition is usually, at least quite often, it's enough to make that business owner go, maybe retirement's not such a bad idea. So,
really important things. The other sort of shift, let's say outside of the economics and the challenges that come with it, is also the way that food is such an integral part of culture, and even at times of how food can be a part of status. Right. And I think, often the conversations, and for many of us, as we all sit in this panel in central and southern Illinois, but, you go and you have your fancy kale shake in, a metropolitan corner. Ms. Sotzenberg, as you guys have really worked with children, mm-hmm. And, you're not necessarily the cool kid if you're bringing broccoli for your lunch.
We're trying to make you the cool kid if you bring your broccoli for lunch.
We would love to hear how you're trying to do that.
Well, we've really put a lot of effort into supporting our schools with this catch program I talked about, and trying to shift the culture, which is very difficult to do. I mean, we know it's a very slow process, but trying to shift the culture to value healthy eating. And we teach the kids, we find a lot of things when working with the children in the schools. We as a culture are, and this isn't even rural specific, but we're so drawn to the convenience food and the processed foods because we want to save our time. And that's what they come into school knowing, expecting, unfortunately having a palate for. That's what they crave. So when they come to the school and we're trying to promote go foods, as we like to call them, the unprocessed, fresh fruits and vegetables, we start with the very building blocks of what a pineapple actually looks like. Because if they even have had pineapple, they don't know. They've only seen it cut up in a plastic, processed cup. So when you expose kids to, kale chips, which we've done, or fruits that maybe they've never seen in whole or heard of. I think what we notice is that we need to start with that knowledge of this is what it looks like. This is why there's nutrients in it and why it's good for you. This is how you can prepare it, different ways you can eat it. And when you get that first knowledge out there, they take to it pretty quickly. If they know it's a better choice for them, the majority of kids are excited to make good choices. And what we see is that I hear in the community, oftentimes the parents will talk about their child coming home and saying, I don't have any Go foods on my plate. I can't eat this. These are only with the categories of Go, Slow, and Woe foods. And they'll say, I only have Woe foods. And the parents, oh, like this is a good thing, but I really just wanted to heat this thing up. It's good to you, you know. So it's a culture that needs to change slowly over time. But as with absolutely everything, it's all about giving the kids the opportunity to know what the good choices are. And that just does take education. And then it takes a lot of people role modeling it for them. And it's a challenge. It's a challenge for parents who are looking for convenience. But if they can see it 8 hours of the school day and then they don't have access to the poor choices, the low nutrient choices, then the broccoli kid becomes the cool kid eventually.
Yeah, and I think sometimes we don't think about those things enough, right? That it's not just the access, but it's also how we're thinking about it. And you know, I love these examples, right? Of just, well, if you see a pineapple and the richness of it, and you know, it becomes a little bit cooler than just eating, you know, pineapple out of a can. And I think just the powerful nature of just these lessons and the work that, you know, the hospital is also taking to get there. And so, Ms. Hawkins, you know, I'd also like to think and take the culture argument and sort of put it into some of the social services that government can provide, right? And, you know, would hear often from, you know, a dear friend of Ms. Hammond and I, Colleen Callahan, who was the former state director of rural development, now our state's director of natural resources, of, you know, I'm from the government and I'm here to help. But sometimes the services that are there, that we're trying so hard, and your work, right? You're trying so hard. You mentioned previously that it's really about, you know, mouth to mouth, right? Word to word between friends. You know, so, but sometimes that's slow, right? And we know that that's the best kind of way to increase our business. Are there other ways? Are there ways to kind of, you know, magnify it? I think this is stuff that we have been discussing all across our webinars, of how communication has been really hard during the pandemic. For public health things, but also from the kinds of services that we provide. And have there been examples of ways to use technology, ways to sort of maybe push the word of mouth in ways that could tell people that, yes, these are here, I'm here to help you get access to some of the services that could really help you or your family?
Right. We have definitely improved in that area. We have a website, a Facebook page that we try to post nutrition information, but especially during COVID, when a lot of places were closed, I guess I assumed that everyone knew we were still open, but that was not the case. And so once we started hearing, you know, when they would call in and say, well, I didn't know you were open, we thought we need to take some additional steps to, you know, let people know through Facebook. And then our website, we did a lot of text reminders. A lot of our clients now like to text. And reaching out to the community partners. Many of them were closed at one point, but just reaching out, letting them know, please send people our way, let everyone know. So, yeah, it was a challenge, but we finally got there. It took about 3 to 4 months for sure.
Fantastic. And so we're getting to 40 past the hour, and just want to pivot a little bit and sort of bring up, you know, the recommendations that we had, you know, in our policy brief. And so, as you've seen from the conversation today, you know, 3 areas in which the state could really work on ways to improve or think about improving rural nutrition and fitness. One, the opportunity to invest in programs that allow for the creation of community-owned grocery stores to bring more fresh food to Illinois' rural communities. You know, examples of states like Alabama, Michigan, Oklahoma investing in awards to provide private or federal loans to encourage the ability, as we've talked about, earlier, to help supplement some of the challenges that, the economy can't provide. Recommendation number 2, to increase participation and retention in the WIC program itself by trying to think through how to enhance communication, as we've talked about, but also figure out ways to streamline enrollment and recertification processes. I think one of the big things that most people don't know is just the fall off of people that start on WIC right after a child is born, but that up to 79% of eligible infants are enrolled in WIC, but that compares to only 25% of eligible 4-year-olds. And part of just sort of understanding, really as, Ms. Hawkins is describing, that people don't know that the service is there. Right? They know that it's there when they're born for their child, but how it can really continue if you need it. And the last one so how do we, and we spent a lot of time talking about and thinking about economic development, is how do we foster the public-private partnerships between government, between hospital systems like Abraham Lincoln Memorial being an example, community-based organizations and private industry to design and build the infrastructure that can promote healthy lifestyles. And what we mean by infrastructure is that we know our rural communities have incredible open spaces, but often those open spaces, they're lacking the types of things, the types of safety, the types of structures, the lack of sidewalks, the cost prohibitions to really use those areas to be fit in the way that we can. And really thinking about strategies of how to do that, and how to think about that in terms of making their community whole and provide the right outlets for people to use those things to eat healthy, but also to be active. So, our group has seen these recommendations. So, and so I'll pause and would love to kind of just open the floor a little bit. What's your immediate feedback when you think about those policy recommendations? Things that I know we've tried, but how do we push these ideas and think about ways to really create the right kind of conversation to begin implementing them?
Well, I'll jump in and say that I think that a lot of municipalities, a lot of potential partners don't recognize that the hospitals are looking for ways to improve health. And they're looking for opportunities because of the Affordable Care Act and because we do a community health needs assessment every 3 years. These not-for-profit hospitals in your community right now are trying to address the health priorities that need attention in your community. So part of it is if you see an opportunity, knowing that a hospital, it might not be something that is on the top of mind for a lot of people, but we've purchased a fitness court for the city of Lincoln and installed it so that we have outdoor free fitness available for the community. We went to them. So if other cities would know, hey, we're thinking this way and we all want to row the boat in the same direction, think of the local hospitals as partners is one potential step. But of course, that's my perspective as a hospital. But I don't think a lot of people know that the hospitals are looking for these opportunities.
And I just jump in too, that's so exciting to hear these stories of what you're doing in Lincoln. And I hope that if rural development can be a partner in some of these projects, that you look to us, because we've helped, Jersey County, or I think it's Jersey Community Hospital, they got a $40,000 grant to put a wellness center within one of their clinics. So just as an example, when you're branching out and thinking of some of the equipment and expansion costs, it can be costly. So we can help with those types of grants. There was a new grant program announced last week on the 12th, and it's called the Emergency Rural Healthcare Program. And it's going to be $6.4 million in Illinois alone, which is huge for us. Our typical grant year, we have about $600,000. There's two tracks. One is for grants of $25,000 to $1 million, and it's for recovery grants that are providing immediate relief to address economic conditions arising from the COVID-19 emergency. Within that grant, we can also assist food banks and food-related projects for nutritional needs, but also specifically health-related needs. So a huge amount of projects could be eligible for that program. Really cool. And then track 2, I think, really fits in with the third priority you discussed, Dr. Bora, and that is, it's called an impact grant. And it's to advance ideas and solutions to solve regional rural healthcare problems to support the long-term sustainability of rural health. And those grants are going to be $5 to $10 million. Both grant programs, they're due October 12th. So this is a short window, but I would encourage all communities that are interested in the rural health and nutrition space to take a look at those. I think we're going to put the website in the chat as well.
Yeah, it's right there. Amanda Fogelman just placed it in the chat.
From the first policy recommendation there, I think that funding from a state aspect really would help, but where it goes also helps. So for instance, a large part of our funding comes from USDA Rural Development through their Rural Co-op Development Grant, and that provides for our technical assistants to come out and help. But a lot of times, our financing system is set up for either nonprofits or entrepreneurs, and so co-ops kind of fall in that gap there where there's nobody that's going to sign a personal commitment, a personal guarantee on that loan, and a startup really doesn't have a lot of assets to borrow against. So for them to find that financing is difficult, and we're actually going to look at the USDA Rural Development Community Facilities Grant as well, possibly down in Cairo, Illinois. Later this fall, we're actually going to start talking about this month, and see if that's something we can do, because the hardest thing for them to fund are the hard assets, the building, equipment, things like that. So there are a few programs. It would be great to see more of that through a state level.
So just want to, for those that have not seen it, right, we do have the question and answer box open. So if people have questions for the panelists, we'd love to be able to take those in the last 12 minutes. I think as we wait for those questions, the next sort of big question to the group, we're at a time of still a lot of uncertainty. Right, and I think, as the summer started, there was a lot of hope of, returning back to somewhat of what our kind of previous lives were. Obviously, as the Delta variant kind of rages across the country, as of yesterday, we only had 3 counties in the state that were not at a high transmission level of COVID. I think one of the things that we want to think about here in this space around rural nutrition and fitness is, well, how do we take those opportunities, right? And I think, as Mr. Park mentioned, grocery stores did okay, right? Because you had to go, you couldn't go out to eat. some of it but we know that it's also been combated with other challenges, right? And one of the big challenges, obviously, is when we talked about at a previous webinar, the mental health aspect of that. And, one of the things that for all of us that we struggle with when we're stressed out is our ability to take the time and energy to, eat the types of foods that we need to. And so as I kind of just step back and would love for each of you guys to take a couple minutes of what in your mind does the future of rural nutrition and fitness look like? And what are ways in your personal work, but also for the state of Illinois, that we could really engage in the right dialogue and action to make an impact? And so, Ms. Hawkins, would love to start with you.
Okay. I think we've learned a lot in the last year, for sure. We keep going month to month, going, how long is this going to last? And I think we finally figured out we need to just pretend like this is going to be permanent and move forward. And I think the coolest thing for me was to see, it took a lot of work to implement new processes and protocols to provide services in a different way, meaning all over the phone versus them clients coming in to the clinic. The state of Illinois implemented a new computer system with EBT cards versus paper, which has made it much more convenient for us now. On certain visits, twice a year, they have nutrition education to be able to, for the clients to do internet education online and then send us a certificate. We talk to them about a food package, any other questions, and just load their benefits. So it's going to, I think this really is going to make it much more convenient for clients to access our services and then to stay on to the program longer. I think they all are aware that they're eligible until that child turns 5. But I think the time it takes to come to the clinic and wait for the appointments, time is valuable to most of them. And so I think this really is going to be a good selling point for us to be able to expand services to all. And it's a good thing. I think we've seen that our visits over the phone, I'm right next to one of our RDs and I hear the conversation she's having, and they are wonderful. The clients are very appreciative that they're getting the same services basically, just without them having to come in, bring the kids in, and it's just convenience. I think that's the key. So I see this program changing to where they're going to limit the number of times they really are required to come into the clinic. So hope that answered your question.
Yeah, no, it did. Yeah. So maybe same question to you, Mr. Park. Where can we kind of make the biggest impact for the future?
Yeah, the thing about the COVID and then the post-COVID, there's a case in Colorado that folks in my circle talk about a lot. It's a small community that lost their grocery store, and they said, well, maybe that's just how it is in a small town. And then they had one of those Colorado snowstorms, and no one could leave town for a couple of days. And so no one could buy any food. They didn't see it coming, so they didn't already have their milk and bread that everybody buys. So after that, they started talking about a local co-op or a community-owned grocery store. And I think maybe the pandemic kind of put that pressure, a snowstorm for everybody, where they think maybe this is kind of a necessity. So hopefully access to healthy food and exercise becomes more of a priority. At least that's what I'm hoping.
Great. Ms. Sotzenberg, how about for Abraham Lincoln Memorial Hospital? What does the future look like for these healthcare partnerships to really impact rural nutrition and fitness?
Well, I think we have tried to have a better eye on recognizing health disparities, recognizing what it means to remove barriers, and the partnerships that we have will definitely continue. I think that we have established really good partnerships already, and I think that that's what everybody, in the community health field needs to recognize, of course, is that it's when we all work together that we can leverage our resources best and make the most impact. One specific thing that I'm thinking about on potentially a statewide level, though, and it goes a little bit back to this food system conversation, which is that if we have a little bit more focus on these industrial kitchens, whether it's a hospital kitchen or jails or, wherever people are making all of these meals, and we're working with local providers of those foods, that is one very impactful thing we can do to also stimulate our local economies. And we all know when you have a better economy, going back to that 80% of your health is determined by the social determinants of 40% of that 80% is the economy, what income people have, what job opportunities they have. And that, I think, would be an impactful thing to rally around as a state. One idea.
It's a great idea. And Ms. Hammond, maybe a slight pivot from everybody else's question is, I think we're seeing, right, the sort of, and even the grant opportunities that you just mentioned, is that because of the crisis and the emergency that we were in, we've had to think differently. There's, a lot of opportunities to sort of spend money, right? And I think across all sectors, we've heard this a lot of, but we've never seen this kind of money come in. But part of it is that, so how do we make the biggest impact, right? And a little bit to the points of Ms. Sotzenberg about the importance of partnerships and the importance of work that's, happening. But we would hate, all of us and this country for sure, not maximizing on those efforts, those resources to make an impact. And so how do we think about it? How do we think about it the right way? And how do the people on this webinar think about the right things to apply for that can make not just the immediate impact, but sustainable impact moving forward?
Yeah, it's a great point. And I think regional is huge. You got to think beyond the individual project and where does it fit into the rest of the area, and how is this going to help not just our organization or this small project, but the greater community, county, etc. I think that's really important. And I think another thing that we've noticed is there are people wanting to move back to rural communities now. And that's so exciting, and that is one benefit of the COVID pandemic is, when you can work from anywhere, why not work with a larger backyard and get out of the city? So I've heard countless stories of people moving back to the rural communities, but it starts with broadband, high-speed internet, which we do have funding programs for as well, and then working with your community leaders to make sure you have the fitness opportunities, the restaurants on the business side, the grocery stores. So we can be at the table for all of those things, and we want to be in those discussions, because then we can maybe think a little bit more broadly than just one project at a time.
Thank you to all of you for this incredible discussion. Thank you for sharing your perspectives. Ms. Molly Hammond, Ms. Donna Hawkins, Mr. Sean Park, and Ms. Angela Sotzenberg, thank you for all the work that you are doing in your communities and for the state. Thank you for taking the time out of your busy schedules to have this discussion. And we thank all of the participants for attending the webinar. Preview, so next month, we'll be talking and thinking about children's growth and development and the way that that's affected rural communities across the state, especially as all of us have just started or are beginning to put our children back into school. And so we hope that you join us on September 16th, 2021 at 12 noon for the conversation on COVID-19 and rural children's growth and development. So look forward to seeing you then. On behalf of SIU School of Medicine's Department of Population Science and Policy, the UIC School of Public Health, the SIU Center for Rural Health and Social Service Development, and the SIU Paul Simon Policy Institute, we thank you all for your time in attending our Rural Health Summit webinar today. Have a good rest of your afternoon, everybody.
Thank you.
Thank you.